Last time we left off with active immunity. Let's start this screencast with passive immunity. Passive immunity does not require the body to do anything. Instead, antibodies are given directly to the individual. Don't confuse antibodies and antibiotics. They are two very different things. Passive immunity acts quickly because you don't have to wait for the body to come up with the right B cell to make the antibody. The disadvantage is it's not long-lasting. The administered antibodies are gradually eliminated from the body, and the person is no longer immune. An advantage of feeding infants breast milk is that mom's milk contains the antibodies her body is currently producing, and the infant receives passive immunity to everything that mom is immune to. Remember, the Rh factor is a type of MHC marker. Rh positive means the marker is present, Rh negative means it's absent. The Rh factor can be a problem during pregnancy if mom is Rh negative and the child is Rh positive. Some of the baby's blood can enter mom's system and stimulate her body to produce antibodies against the Rh factor. These antibodies can cross the placenta and affect the child. The production of antibodies can be prevented by administering a RhoGAM injection. The Rh factor is not a problem if mom is Rh positive and the child is Rh negative, because the child's Rh negative blood does not have the marker and therefore cannot elicit a response from mom's immune system. An allergy is the result of your immune system responding to something such as food, pet dander, or pollen as if it were a pathogen. The watery eyes and runny nose that often accompany an allergy is the result of the production of histamine. In extreme allergies, histamine is produced throughout the body, and the resulting fluid loss from the circulatory system results in low blood pressure and the failure of the circulatory system to function properly. This reaction is called anaphylactic shock and can be quickly fatal. For mild allergies, antihistamines can be an effective treatment. Autoimmune diseases, or sometimes called autoimmune disorders, involve the immune system attacking healthy cells. Multiple sclerosis, lupus, rheumatoid arthritis, and at least in some people, perhaps type 1 diabetes may be an autoimmune disease. In type 1 diabetes, the cells that produce the insulin are destroyed. At least in some people, this may be the result of an infection and the immune system goes too far and kills all the insulin-producing cells. In rheumatoid arthritis, the immune system attacks the joints. For a lot of these, we really don't understand what triggers the immune system to go way too far. In tissue or organ rejection, the white blood cells attack the transplanted material. Unless the patient receives a transplant from an identical twin, the match will never be perfect and the immune system will respond. Transplants are successful only with the administering of drugs which suppress the immune system. The problem with these drugs is that they compromise the immune system and the patient becomes more susceptible to other diseases. Let's take a break. The next and final screencast for Chapter 13 will discuss AIDS.